Welcome back. Well, the Indians in the Medicine program at UND School of Medicine and Health Sciences is approaching its 50th year anniversary. So here today to talk about the organization is Dr. Donald Warren. He's the director of Indians into Medicine. Great to have you here. Thanks so much for joining us.
Yeah, happy to be here. Thanks for having me.
I'm embarrassed to say I've never heard much about this program, so if you can give us a synopsis, that'd be great.
Sure. Indians into Medicine, or the InMed program, has been around since 1973, and the focus is to increase the numbers of American Indian healthcare providers, primarily in medicine, but also other aspects of healthcare, so more physical therapists, occupational therapists, nursing, etc. So Indians into Medicine starting in 1973, that means the first year medical students are the class of 2023 right now, so they are the 50th anniversary class of InMed.
Wow. So talk about the distinction. I think by having Native Americans going out and being PTs or doctors or whatnot, what kind of impact do you think that's going to make overall in Native American health?
It has a huge impact. But one of our big challenges is that we have terrible health disparities, but we also have a lack of providers. And we have shortages in physicians and all aspects of healthcare in American Indian populations. So what we've seen is that American Indians are more likely to go back to work on reservation communities where they're needed the most. So we've had a tremendous amount of success. We've actually now, through InMed programming, graduated 240 American Indian physicians.
Wow.
Yeah.
And are they at reservations all over the country or mainly in our area? Or?
Yeah, and we've been tracking where they're located. Actually, the president of Sanford Bismarck is an InMed alumnus. One of the tribal council members at Mandan Hidatsa Recreation Nation is an InMed alumnus. And we have 5 physicians at the Fort Yates Hospital at Standing Rock who are InMed alums. So yeah, they're all over the country doing all kinds of wonderful things, but really giving back to the tribal health needs.
You talked about some of the health disparities, and if you look at the data on reservations, there are a lot of health disparities. So what kind of impact, or what do you see as the biggest, hey, if we could just start to do this, that would have the biggest impact on health outcomes on reservations and for Native Americans?
Well, there's no single solution. It's a very complex challenge that we face. So I look at this really as a more comprehensive issue. So we also have a master public health program in which we're trying to train health professionals to focus on prevention, as well as, of course, in medicine and treating disease. So we really need to look at this more comprehensively, and I think addressing chronic disease disparities, mental health disparities, and those types of challenges. But in addition to that, I think the upstream root cause for many of these challenges is unresolved trauma. We see a lot of historical trauma, adverse childhood experiences, and the long-term outcomes are worse health status in terms of mental health and physical health.
Talk more about that, because I was actually talking to somebody last week about the historical trauma that Native Americans experience, face, and I think for some people it's hard to fully comprehend that.
Yeah.
So explain that a little bit more.
Probably some of the best research into historical trauma has been with the Holocaust survivors. And what we have found is that direct descendants of Holocaust survivors tend to have worse health status than other people of similar race, ethnicity, and background. So what we see is that when there's tremendous population-wide cataclysmic events, we see long-term intergenerational impact. There's been some really good research into the field of epigenetics, and what we're seeing is that high concentrations of stress have an impact on gene expression. So it actually changes DNA. And we've seen this in animal models. So one of our projects is to look at this in humans and see what is the impact of chronic toxic stress, not only on that individual, but subsequent generations.
So with that being said, is there a way to, I look at our health care system today and really consider it a disease management system. Yeah. So is there a way to integrate maybe some of the older Native American ideals and health principles into what you're doing today, and what would those things be?
Absolutely. Focusing on prevention is vitally important. It's interesting we call ourselves healthcare providers in medicine, but we really are disease care providers. That's what we really focus on. Except in public health, we do focus on promoting health. And there's, very briefly, just a quick story from a traditional perspective. There's a story of 3 sisters walking along a river. And as they're walking along the river, they see babies and young children in the water struggling to stay afloat. The first sister says, "This is an emergency. We need to get the babies out of the water right now." The second sister thinks about that and says, "No, we need to teach them how to swim so they can survive while they're in the water." And the third sister keeps walking upstream and says, "I'm going to find out who's putting these babies in the water, and I'm going to stop them." And that's literally working further upstream. So from my perspective, public health is traditional medicine from an American Indian perspective, but we need all 3 sisters, right? We need to treat the emergencies and crises, we need to manage challenges, but we also need to prevent.
It'd be nice if you can get the one upstream to stop it completely. But so are you doing some kind of outreach as well to Native Americans right now and go, hey, this is a great program, here's some ways we can help fund it? And
Yeah, and we're working collaboratively with the tribes, certainly in North Dakota, but throughout the region. And we are developing research projects. We're hoping to establish an Indigenous trauma and resilience research center. So it's not focused just on the risk factors and the negative outcomes, but also looking at the strengths and resilience of our populations and how do we leverage that to promote health and prevent disease.
great stuff. Thanks for being here.
Oh, happy to
I
be
really
here.
appreciate it
Yeah.
a bunch. All right, stick around. We got much more coming up right after this.